There are two intestinal parasites or protozoal infections that both can cause watery diarrhea, but have differences in terms of how they infect people, but also how they are transmitted. Cyclospora caetanensis infects humans through contaminated produce and can be associated with both traveling, but also through importing contaminated produce and consuming it. General rule of thumb is having effective washing of produce. So unfortunately, you can't control when you go out to eat necessarily. Cooked foods are usually, rule of thumb, much safer than raw foods when going out. But when you have the ability to control the produce at home, I generally advise patients to not only do a deep wash, which means soaking it in water while I remove any external layers or shells. So like if you have a head of lettuce, for example, removing the outer layers that are more likely to be contaminated than the inner layers, then separating all the pieces, making sure it's washed well. Cryptosporidium, on the other hand, is a parasite that we have ongoing exposures to throughout the United States, unfortunately, and we tend to see outbreaks in the context of water parks, a lake, through daycare, childcare environments. Unfortunately, because it is highly resistant to chlorine, it can also, once it gets into, say, a water source, a water park, it can then stick around for quite a while and infect other people. The mainstay of treatment for both of them is through rehydration. So trying to keep up with what you're losing with the diarrhea. So I advise patients to focus more on hydrating with electrolyte balanced solutions, products such as Pedialyte, for either adults or for children, and then monitoring your urine output every 4 to 6 hours. That would give you a sense that you are hydrating sufficiently.